what you can get from Indonesia, the implementation of universal health coverage through JKM has improved health access and financial protection for its population. Challenges in pharmaceutical policy, such as harmonizing the catalog and national formulary, need to be addressed, and it is opportunities for collaboration between one of us, maybe. We can collaborate uh, in research, knowledge sharing, and policy development in the healthcare. Yeah, before I finish my presentation, I would like to leave you with a powerful word from the Director General of the WHO. His name is Dr. Pedro Adhanom. He said public health. His name is Rizwan Wakil. In the spirit of Asian unity, let us work together to build a region where every person access to quality health care. By collaborating and working together, we can achieve universal health coverage and make a healthier future for everyone. I think that's all. Thank you for your attention. I hope you enjoy
Thank you so much, for your presentations. I believe people perceptions about some of people perceptions about medicines are still questionable. Not to mention the complicated to access through technologies. If the medicine itself confusing, people won't bother to use technologies. That's why this kind of system need to be promising, need to be trusted, and again we are talking about accessible, affordability, availability, and government support and funding, of course, for the health insurance in Indonesia and of course in all of the world. Of course, we are sometimes we are reducing healthcare costs for families requires. We are increasing the competition in healthcare insurance. I say we all should have free health insurance, is it right, Mr. Wasir? Okay, thank you very much. We're moving on to the next speaker. Our first speaker is Mr. Nopado Pecha, born in Nakhon Si Thammarat Province, Thailand, on 1st May 1992, with education background of PhD candidate in tropical medicine, Manila University. For Mr. Nopado, please kindly join me on stage. Okay, so Mr. Pecha expertise in environmental microbiology and now positioning as Assistant Dean for International Affairs and Lecturer in Environmental Health. Mr. Pecha will be presenting the introduction of Walailak University. So for Mr. Pecha, yes.
So thank you very much for introducing myself. So good morning everyone. So Dikra and selamat pagi. So this morning, first time when I visit the colleague in PNBJ, I just confused about the word. How do you say good morning? And I use the terima kasih instead. And so, selamat pagi is correct. Okay. So, my name is Dr. Reja. Actually, you can call me like right? For short, the lecturer in the School of Public Health Walailak University, and also be the Assistant Dean for International Affairs. So thank you very much for your very warm welcome from our NVJ today, and we are very honored as well to visit here, and there are so many students. So today I'm gonna introduce you briefly about Walailak University, and if you have chance to visit Thailand, you can come to us, and we are very welcome you all. Does anyone have chance to visit Thailand? Any? Oh, really? Maybe some of you, if you go to Thailand, you may be visit Bangkok. But our university are located in the south of Thailand. It's in the beautiful beach and others many things interest in the south of Thailand. So if you have chance, please visit us. Okay, just briefly today, I'm gonna give you about video presentation for our Walailak University. Can you open the video? Yes.
Welcome to Walailak University. It is located in the southern province of Jakarta. It is one of Thailand's. Late in 2022, for the first time in its 30-year history, Walailak University was recognized as a world-class university by Times Higher Sciences in the country. The of the university has been spearheaded of Walailak University. A major reform in teaching and learning was launched in 2018. As part of the reform, Walailak University adopted the United Kingdom Professional Standards Framework, or UKPSF, to train the teachers. The framework has served as a strong basis for the university's policy to promote teaching critical, analytical, and synthetical digital technology and artificial intelligence for classroom and laboratory learning and teaching. Walailak University places important standard facilities to promote the quality of life for students, such as on-campus dormitories with 24-hour security systems, electric shuttle car services, counseling service, places for recreation and religious practice, and a sports complex. Walailak University is committed to its educational philosophy of academic excellence and expertise in practice. Before graduation, all students are required to further put the knowledge and skills they have acquired in the classroom to practice at the currently goal for students to enhance both their professional and 21st century skills necessary for their future careers. Walailak University is one of the top universities in the nation that produces high quality and internationally recognized research. Our faculty members commonly publish their studies in top-level world-class journals, particularly Quartile 1 and 2, that have attracted worldwide citations. Meanwhile, Walailak University also supports academic services for sustainable social development based on the United Nations Sustainable Development Goals, or SDGs. According to Times Higher Education, Walailak University is currently ranked between 600 to 800 in the world on the impact rankings. Walailak University is a green university with sustainable development in all aspects under the concept sustainability for all, by improving the landscape, buildings, and facilities so that they are more sustainable and energy saving. We also aim to make the university recreational for both students and staff and the public. Walailak University has been voted 111 globally as the world's green university by UI Green Metric World University, and first in the southern region of Thailand for 3 consecutive years. We have built Walailak Park at the entrance to the university. The The park is the largest ornamental garden of all universities in Thailand, combining land and lake for the total area of about 100 acres. With a 1.7-kilometer promenade that stretches along the lake and sets against the Khao Lon National Park mountain in the distance, Walailak Park provides one of the best and unique sceneries that one may find, complete with clean and fresh air. Furthering its green credentials and natural beauty, Walailak has a 1,350 res, or 534 acres, continental park that also serves as a platform for learning resources for the community in the south. It features the Tepra Kratsuda Natural History Museum, Lotus Sky Tower, cactus gardens, nature trails, bird gardens, and many more. We are proud to have been hosting study visits for both Thais and foreign travelers who, when on the boat to Sky Tower, can enjoy one of the most beautiful landscape views in the area. In healthcare, Walailak University Hospital plays a pivotal role to people in the upper healthcare profession. At present, Walailak University Hospital, as a foundation, a private organization, provides medical care for monks and other religious figures. The hospital aims to serve more than 300,000 patients annually. Although Walailak University is only 3 decades old, we continue to move forward to unceasingly advance our academic and research work, adapt to the changing world, to better serve the community and society, and to be a university of quality that is recognized worldwide.
Yes, so thank you very much. So this is our university, Walailak University. So as you have seen in video, the located of Walailak University, we are located in the Kasala district, that are the biggest Muslim community in the country, Samarat. And we also have like a multicultural that we have mixed it with other religion and other culture. That's why the Walailak University is quite, like convenient for all students to. And our university, we currently now student more than 10,000 students, both of the undergrad and postgraduate students, and we also have the 20 school on the college divided, as you can see in the picture. We divide the undergraduate study into three groups. First one is the health side. Health side group, we have seven groups, seen from this dentistry, health side, veterinary college, nursing, public health, pharmacy, medicine. And we also have science and technologies, and also social science as well. And one colleague for the colleague of the graduate study at Walailak University, we have both the master and doctoral degree. That if anyone interested to study in Thailand and particularly in Walailak in for postgraduate study, you can scan this QR code and to see more information for other program in Walailak University. And also even we established from 1992, almost maybe 30 years ago, we are a young university in Thailand. But last year, as you have watched in the video, we have first time we have ranked in the Thai application, and we hope to improve our quality in work of research and study to get better rank for them. And maybe this year we hope to get the better ranking in Thai application. And also for PS ranking, we also rank like this. For our school, I'm going to briefly you a bit on the school of public health. Our school, our mission is natural leading public health institution in teaching, management, and international standard research. And we also have the mission, as I told you, particularly for the international standard teaching management, lifelong learning that we try to push our students to be a lifelong learner, and also develop a center of excellence, particularly for the research center, and also academic service that we have to if apply our academic our knowledge to the communities and to create a happy organization that is important for our school of public health. So currently we have totally 50 faculties in School of Public Health. We have only one professor and six associate professor and also assistant and lecturer. Um, in Walailak University, we have the UK USF or UK United Kingdom course and that. We have totally students around 800 students in both of undergrad and postgrad. We have totally three programs in bachelor degree. We have environmental health program, occupational health and safety program, and also community public health. Totally the undergrad, and we also have the postgraduate program as well in School of Public Health of master and doctoral degree. Master in the health, environment, and safety, and also in the public health research. In this program, this is the international program for public health research in both master and doctoral. So, can I show you a bit of highlight activity for public health teaching and modalities? For research, we may have chance to discuss with the staff from Faculty of Health of NVJ today. So currently, School of Public Health, we have like a collaboration, particularly for the MOU, maybe with 12 collaborative university in the 7 countries around the world and hope to more get more from Southeast Asia and other countries in Asia and other part of the world, not only in Asia. And this is the some of international collaboration of the School of Public Health in Walailak University. We also working with other institutes in many countries around the world, particularly seen from the American, Asian, also in our nearby country, particularly for the Malaysia and Indonesia. We have a strong collaboration with the both Malaysia and Indonesia institute. And last years, we have ranked for top two in Thailand for the research in the public health, environmental health, and occupational health that generate from the public health field. And this is just going to show you a bit on our research area in public health. We mostly work on the pharmacology, toxicology, environmental science, medicine that we have done. And we have 5 research areas for lecturers in School of Public Health. So first one is the epidemiology and infectious disease prevention. This is the main field of research in our School of Public Health, and I will use it here. And also climate crisis. This is very important, particularly we have like the environmental health department that work on the environmental factors that relate to the health problem. And also environmental epidemiology is quite important in Thailand because there are so many diseases occur from the like environmental factor related to the disease. That's why we try to study more and more on the environmental epidemiology to find out which factor in the what environmental factor that can harm to the human health and try to prevent and limit them. Also, epidemiology in health policy and healthcare system is also our main research area for this in south of Thailand. And finally, we also have the injury epidemiology for the lecturer in the occupational safety. That's it. I show you about our program and our UK professional standard framework that we apply for teaching for student learning. So if I have chance, I will get my student and tell you about our study in Walailak University. And this is an example for our active learning study in the classroom. We also have the laboratory for all program that push them to get more the practice about the laboratory. And for example, for classroom activity, as we mentioned, active learning is not just the lecture. Our students can do anything by themselves, can think by themselves, can apply can search more any in the class. And this one that we studies in Walailak University. And also field activity is important, particularly for the program that try to apply for the community. We bring our students to the community, to the environment, to do this the real thing, to prepare them before they go out to work. Really, that's why we concern on this. And also every semester we also invite the international guests for give a lecture, like guest lecturer from any field around the world that we have invite them to give our students to see more, like to see more the view of like a trend of other country around the world, not only in Thailand. And student and staff mobility, School of Public Health, we have this chance to student to visit other country abroad to see, like the learning style in other country to, like exchange the culture. And it is just an example for a cooperative education. It is very important in Walailak University. In the first year student, we um, if the student go out the university to apply like a cooperative study in the real workplace, and this is an example. And in Taiwan, our student, and maybe this year we also have the student that go to cooperative study in abroad as well. And it's an example with the UPM in Malaysia. We have like student mobility working out loud, and it is the University of San Malaysia last year after COVID-19 pandemic. We bring our students to the USM in Malaysia as well, and also Vietnam last year as well. And for the graduate study, we also give this the student bring them to abroad to see more about particularly for the research, and also welcome our students from abroad to Walailak University as well. We have the, particularly for the graduate study, we have so many research topic with the many lecturers that, and also some mobility even in the COVID-19 pandemic gave the special lecture for a university, particularly for the Udanaja University in Bali, Indonesia as well. And also after COVID-19, we have to welcome the staff from Hokkaido University that visit us. And actually, that's all for my introduction for Walailak University and School of Public Health. So actually, if you have any question or if you're interested in Walailak or any idea, you can talk with me later. And if you want to try find more information, you can find in this website. Okay, if you want to get more information, please come to ask me. Okay, thank you.
Thank you so much, Dr. Toro, for your wonderful presentation. Please join us on the stage. Okay. I am myself considering on searching for a master degree abroad. Probably Walailak University will be one of my picks for my master degree. Okay, moving on to the next sessions, we will have our fourth speaker. Our fourth speaker is Dr. Praset Makhel, PhD, or we can call him Dr. Patrick. Dr. Patrick, born in Suratani Province, Thailand. Dr. Patrick, educational background in PhD, environmental health in Flinders University, Australia, with expertise of food safety, health-related water microbiology. Dr. Patrick is a lecturer in environmental health and international affairs committee who have hobbies of singing, reading, and chilling with Netflix. I must say a very interesting hobby, Dr. Patrick. I am myself love to watch a movie, also love to sing, but yeah, I don't have really good voice. Without further ado, for Dr. Patrick, we'll be presenting about COVID-19 wastewater surveillance and water source contamination, a case study of Thailand. For Dr. Patrick, you may present.
Thank you, Mr. MC, for your very nice introduction. And very good morning, and Sawadee Krap, and Selamat Pagi for everyone, and especially the director from International Affairs, and all the lecturer speakers, and the future public health professionals who study here. So it's my great honor to be here. This is my first time in Jakarta, in Indonesia. So yeah, so I'm very excited to be here, and it's very honored to talk today. So let's come to my topic today. Actually, my topic is COVID-19 and with environmental dimension. So not only me, but also Ibu Ami, but later. So this is my time. So please like spotlight on me and look at me, okay? So yeah, the first talk that I'm gonna do is COVID-19 wastewater surveillance. So actually everyone knows COVID, right? Because it's like ruined our life for like 3 years since 2020 until now. But from your general perspective, is that like it's ruining our health, also health system and economic. But today I'm gonna point out you in the another side of the COVID-19, which is focused on the environment. So the first thing is the COVID-19 wastewater surveillance, and after that, Ibu Emi will talk about the knowledge and practice in face mask disposal during the COVID-19 pandemic. But I will talk this first. So this is the COVID-19 wastewater surveillance. Actually, this is a part of my research that I've been done with also Nopedon and also my colleagues from Chulalongkorn University, Chulapon Research Institute, and Timuk with University of Technology, Chonburi. Okay. Wastewater surveillance, you might have not heard or you have heard. Basic, generally, the other term they call wastewater-based epidemiology or WBE. So what is WBE? So WBE basically is a population level approach for monitoring consumption or exposure to chemical or pathogens. Actually, it's originally used to estimate the illicit drug use in communities. It happens like um, about 2005 in Italy. At that back to that time, the scientists they collected the water from the river to estimate the illicit drug exposure in the community's level. And after that, the scientists they try to apply this concept to other diseases, not only chemicals but also the pathogens, including the SARS-CoV-2, which is the agent of the COVID-19. So the different point between the conventional the surveillance system in terms of the clinical one and the environmental one is that the it's okay. So the results are population level because like we try to extrapolate in communities level, but from the clinical data, actually they can reflect the individual health or the individual level. So it's a different, the big different point between the wastewater-based epidemiology with the conventional one. Actually, this kind of method is accepted to, this is the alternative way to estimate the use of legal and illegal drugs abuse in the community, as I say, because the biomarker or the thing or the metabolite that existed in the human excreta or the wastewater can give this information on health, disease prevalence, and population habits. That's why we use this method to reflect to be one of the measures to prevent and control of the infectious diseases. Okay, this is the concept of the WBE in the past. As I told you, that is originally used in illicit drug, illegal use in communities. So this is the community that comprises of the like many villages, hospitals, or like many facilities, like department stores, this kind of thing. And everyone, as a human, we have to go to the toilet and poo, right? So every single poo, go through where? The wastewater treatment plant. So that's why the scientists try to collect the wastewater or human excreta and look at the metabolites or we call biomarkers in that to reflect the exposure of the drugs in the communities, and they can calculate back into the exposure for the population in that community. So in terms of the COVID-19, as I mentioned before, like everyone goes to the toilet. So I love this quote. This quote is from Professor Gordon Van Diemen. He's an expert in health-related water microbiology from the Netherlands. Ignores our food to reflect the health status and can make the measure to prevent the infectious disease. And why we have to we have to find another option to control or prevent our disease. Because in terms of COVID-19, you can see this is a limitation of the COVID-19. Like asymptomatic COVID-19 case range from 40 to 79%. It means that like in the past, we got the symptoms, right? And then we go to the hospital, and then we got the diagnosed, and we know that, oh, we got COVID-19. But you can see 40 to 79% is asymptomatic. We don't really know that we already got the SARS-CoV-2 in our body. So this is one of the benefits that we use the human excreta to diagnose in stage. And also the kind of the workload of the health professional or medical laboratory scientists that they use a lot of the the budget or time to spend for the RT-qPCR, and also at some point the prevention and the conventional one, I mean, the health measure is quite delayed. That's why we try to find another option, which is the WBE. So from this figure, you can see like the patient or everyone goes to toilet, and then the pool like going through the wastewater treatment system plant, and then we collected the wastewater samples and to analyze the RNA virus by qPCR, and then it means that they can detect both asymptomatic and symptomatic because like they are both combined in the wastewater treatment plant. So then there are so RNA amplification method or like qPCR. And actually, it's not really new technology to intervene. Actually, the worldwide countries around the world, they already like detected the SARS-CoV-2 in the wastewater, and also they already adopted the this measure to be one of the measures to prevent the pandemic. For example, in France, USA, India, Spain, Japan, Australia, or UAE. But in terms of Thailand, like I and my colleagues, we already detected SARS-CoV-2 in the wastewater. But in terms of the system, and the monitoring of some of the system, we are not really yet to adopt for full scale because there are lots of the limitations that I talk to you later. So next I will show you a bit about the results from our research that we did analyze the SARS-CoV-2 in the wastewater from Bangkok and Phuket. So Phuket is a very popular province, and I'm sure some of you guys have been there before. So, and here, this is the dynamic of significant SARS-CoV-2 variants in Thailand from the beginning, like Alpha, until the Omicron. This is the general variants that we found in Thailand. So, this figure show you the variance from the clinical data in Thailand from the 2021 to 2022. I want you guys to remember this figure because this variance is come from the clinical data. So our research, we have a question that can wastewater-based epidemiology track the dynamics of SARS-CoV-2 variants? So let's see the results. Not yet the result. So I want to show you the location of our sampling point first. We did collect the samples from two locations. Yeah. So we did collect it from four municipal wastewater treatment plants in Bangkok and three wastewater treatment plants in Phuket plus one airport. And we did analyze some variants of the SARS-CoV-2 in the wastewater. So this is the comparison between the variance between clinical data and wastewater. This is from Bangkok, and this is from Phuket. But just roughly quick here. But this figure is very important. As I try to remind you guys, I try to remember the first figure about the variance from clinical data. And the last two figures is from environmental data, it's made from the wastewater. And you can see that actually, oops, sorry, the variance that we found from the wastewater can reflect the variance that we found from the clinical data. It means that testing from the wastewater can reflect the clinical data. And also we found that in Phuket, you can see here, in Phuket, the last bottom one, the Omicron BA1 and BA2 emerged earlier in Phuket than Bangkok. Because at that time, Phuket was the first province that opened for the foreign travelers to come. And then the international travelers, they arrived to Phuket. And we detected the variant, the Omicron from the wastewater. And after that, it spread again in Thailand, in other provinces. So it can prove that the wastewater-based epidemiology can reflect the clinical data and can be one of the measures that can prevent the disease. However, there still have some limitations or still got some questions that we have to work out more. First one, where gonna be the sampling points or where gonna be the best location that can be monitored? Because one of the big problems of the UPE is that it's very costly because we use the we assume that Bangkok and Phuket might be the two best locations to be the sentinel site because it's the tourist provinces. Also, we still have to think about the frequency of the collection because of the cost that I told you before, and also the target genes and analytical methods, particularly for the analytical methods. Because if you try to find like the journal applying in COVID-19, you will see the different methods of the concentration of the wastewater. There are so many options. So all the scientists we have to collaborate and make the conclusion that what is the best option that we have to use to apply for this measure. And also about the data. And not about the data, it's also about the organization as well. Because in terms of the disease, of course, the Minister of Public Health is the main minister to responsible for the COVID-19, right? But in terms of the environment, we have the Ministry of Environment, Natural Resources and the Environment that they are looking for, looking at or taking care of the wastewater treatment plants around Thailand. So it's kind of, when we look at the wastewater, it's kind of something between the health sector and environmental sector. So we have to make a conclusion that which one is going to be the main responsible for this kind of measures. And also they also have more limitations like the budget that we talk, the organization, and also the knowledge of the scientists. Like from my work, actually we collaboratively work with the University of Yamanashi. So we got the funding from the leadership funding, and our principal investigator is Professor Ichi Haramoto from the University of Yamanashi. So this kind of limitations as well, we have to, like the government, if they are interested in to adopt this kind of technology, they have to invest more resources, money, also the knowledge to make it happen in the future. And that's all for my presentation about the WB, and I hope that you can get some new knowledge for this topic. And thank you very much for your attention. And next, you're gonna listen to another dimension of the COVID-19, which is the knowledge and practice of in face mask disposal.
Interesting point of view for wastewater utilizations on detecting or tracking of COVID-19. It can be easy, of course, for the surveillance to track the possible probability of that's okay, the probability of SARS-CoV or other diseases through the wastewater utilizations. Okay, moving on to our last presenter. Our last presenter is Miss Mary Sarako Chidima, or Miss Emmy. You can call her Miss Emmy. Born in Songkhla Province, Thailand, Miss Emmy, PhD candidate in Environmental Management in Songkhla University with the expertise of environmental management. And Miss Emmy is a lecturer in Environmental Health Department and International Affairs also. Miss Emmy hobbies in traveling and cooking. Also, I love travel. I indeed traveled to southern Thailand to Batalung in 2020, and I must say, Batalung have a wonderful people and wonderful culture also. Okay, so probably moving on, Ms. Amy will be presenting about knowledge and practice of face mask disposal among university students in southern Thailand and to promote the COVID-19 pandemic for Ms. Amy.
สวัสดีGood morning สวัสดีค่ะ You can call me Amy for short. Yeah. Thank you for having me today. Today I would like to share about the knowledge and practice of face mask disposal among university, especially in Thailand. But first of all, I would like to First of all, I would like to briefly about infection risk. Does anyone know about the infection risk? Okay. Infection risk. Uh, sorry. According to the WHO, infection risk is mean waste is contaminated with the blood and other bodily and other bodily fluid, such as snot and saliva, yeah, and also from infection agents from laboratory and waste from patient with infection, and also include the sharp waste, pathological waste, and microbiological waste, and also contaminant personal protective equipment. Yes, and how about the risks associated with infection waste and human health? Infection waste have a harmful microorganism that can infect to people, and also may include drug in resistant microbialism, which spread from health facility to and it can cause into the environment, and may also cause a sharp inflict injury and infection And as we know, the contaminated waste can cause an infection like COVID-19. So the proper management of infection rate is very important to prevent the spread of the disease. So when you have to handling the infection rate, make sure you have to use appropriate PPE and make sure you separate the infection waste to specific bin or container with with clearly label and with biohazard symbol like in the picture. Yes. And after that, the infection waste can be treatment by several methods such as microcurring, incineration, chemical disinfection, and microwaving. Do you know as we know, the major source of the infection waste is come from hospital and also include laboratory, mortuary, animal laboratory, blood bank, and nursing home elderly. But in the during COVID-19 pandemic, uh, the infection rate we have to use the face mask to prevent the spread of infection disease until now that we have to use the mask. So the use face mask can be contaminated with the pathogen and can lead the spread of disease. So the proper disposal and management of the use face mask is very important to protect our health and environment. So when you have to discard, when you have to need to discard your face mask, make sure you remove the mask by the ear loop or the ear loop and we have also to follow local regulation for waste disposal and encourage individual responsibility in proper disposal. So now I would like to share my study, knowledge and practice of face mask disposal among university students in Thailand and post-COVID-19 pandemic that published in the Postman Journal last month. So we aim to determine the knowledge and practice relating to face mask disposal and associate factor among university students in Thailand. Questionnaire for data collection from health science student program and non-health science student program. Uh, we got a total of 433 respondents completed the questionnaire. The results show up to 70%. The student did not reuse their face mask and they wear their face mask for over 3 hours. And the result about knowledge and practice that show the student has poor knowledge, but they have a good level of face mask disposal practice. And when we compare between health science student and non-health science student, we found that, and about the practice, they also show correlation with the sex, academic grade, and academic program. As there was a positive correlation between face mask disposal knowledge and practice, as we see, the face mask disposal practice was found to be significantly associated with knowledge regarding face mask disposal. And fourth year student, female and student with good knowledge, found to be significantly associated with a good face mask disposal practice. Also, we can say the overall knowledge of waste management also among university in Thailand was poor, while the practice was good. So this indicates a lack of information regarding the proper disposal of used waste mass, and this can be the result of inadequate classroom teaching on waste mass disposal and poor quality of the information obtained from online source. So in this study, we set the 5 points of conclusion. The first one is the students have a poor level on waste mass disposal, but they have a good practice. And second one is demographic factor is not in. University have to continue what reinforcement by raising awareness and educating students to on proper cosmetic disposal to could help reduce the environment contamination of infection waste. And finally, the outcome of proper infection waste management may also result in reduced restriction in future pandemic. So this
Mr. B for your presentation. Please kindly on the stage. The pandemic COVID-19 already having a massive impact on waste, especially on waste. And one of the infectious waste is face masks. Syringe issue that infected with blood or saliva. It need a proper care, and one of the solution is to have innovation on how to utilize or treat the infectious waste. Okay, thank you so much, Ms. Amy, for your presentations. Now, all of our presenters already present their presentation. Moving on to our next session, and of course, the presentation will not be complete if there are no discussions. So we are moving on to the discussion session. For the participant that would like to ask some questions or perhaps giving an opinions about the presentation, please kindly raise your hand first. Anyone who want to ask a question? Probably somebody can help me to get the microphones. Please kindly raise your hand. Questions about the wastewater, about ratio mass disposal, or probably if you want to take a master degree in whatever university, you may ask a question directly. Okay. Already we have one question. Yes.
Selamat pagi untuk teman-teman semua. Good morning for the speakers. Thank you very much for the presentation of material on universal health coverage, technology innovation, and wastewater waste from each speaker. First of all, my name is Ryan Mahardika. I am public health student in UPN Veteran Jakarta. My question is that I have an interest in the difference between the universal health coverage figures in Indonesia and Thailand. I have the data from the World Bank is Indonesia universal health coverage is 34.76% and Thailand is 8.51%. And my question is, what step that Thailand do in collaborating on technology and the role of public health in increasing universal health coverage, and what step have Thailand been able to achieve the minimum number of universal health coverage from WHO is 20%, below 20%, and is focusing on the environment is a big step in bringing Thailand to universal health coverage. Thank you.
Okay, who will be addressing the questions? Yeah, I mean like to which anyone? Oh, anyone, okay.
Okay, thank you. I can't remember your name because it's very long, but you said very similar.
thank you for the question. First of all, I have to say that I'm not from the like health policy, like I'm from more environmental health, but I can show you something. I cannot answer your question like how do we like increase the number of the health coverage, but I can tell you about the health system in Thailand, so can see the you can see the overview of the Thailand. So actually, I'm quite surprised as well when I see the data in terms of the number because I'm quite confident at some point about the health system in Thailand because in Thailand we have like in every single community in the sub-district level we have the primary healthcare center which is called sub-district health promotion hospital or โรงพยาบาลสุขภาพตำบล in Thai. So actually in that place the government provided us with the the professional nurses, the public health officers, and all of them they are taking care of the health of the people in community. And actually the people we also have the health what is it called the health not health certificate like the card we have the like the guarantee card that once we go to the health service provider we don't have to pay like some but they have the list of the some of the treatment and medicines so it means that in the community level we have specific places to taking care of the community before going to the community hospital or the center hospital. So that's what I wanna share. But in terms of the policy, unfortunately, yeah, I don't really know about the big policy hospital, unfortunately. But if you want to know, go to Walailak University and I will find the proper lecturer to teach you.
Just to add something for universal cover in Thailand, totally all Thai nationality. We also got the universal cover health since we was born. But for in Thailand, maybe same in Indonesia. Even if you have a UC, that some guy they buy insurance, and then maybe for better health care, particularly for the private hospital or something. But because for the I do like the public hospital is quite easy and a lot of people to use the service, but that's why so many people got the insurance to get better health care.
Okay, thank you for the answer. For Mr. Raihan, do you have your answer already? Okay, thank you so much for the answer also for the speakers. Moving on to the next questions. Okay, Holly, please add.
Okay. Good morning and selamat pagi. Thank you for presentation and attention for the Masyarakat Thailand. I introduce myself. My name is Hasbi Mita Farid. You can call me Hasbi. I college student in Kesehatan Jakarta, Public Health 2021. This one question is about UHC in Thailand. Are there the same Thailand target for the Indonesia? And what as well as the biggest innovation and challenges that Thailand must to achieve in the future regarding this UHC? Thank you very much.
Okay, thank you so much for the questions. Hasbi, to whom you addressing the questions? To everyone.
So Hasbi, oh sorry, Hasbi. So thank you very much for your question. So actually, for the like technology, health technology is very important right now. So since COVID-19, we also apply more technology, a lot of technology to to eliminate and prevent and control the disease, particularly for the skeleton branch. That's very important in Thailand during COVID-19 and also apply more after COVID as well. it's very easy for the people in the rural area that does not, access a big hospital. That the teleconference medicine can help them to, like meet the professional doctors, medical doctors, and to solve the health problems. And I think Indonesia may also have this one, right? And also other technology, particularly for the AI, artificial intelligence, is also being applied for the health, in particularly for in the hospital. But right now, the mostly big, or only big hospital in Thailand, the technology for the this.
Hasbi. Okay, I can remember your name now. I want to add some more about the innovative related to health. But just from my talk, actually, the WBE is one of the innovation of technology as well. But lots of people haven't realized that because we try to distinguish health and environment like separately, but actually it's interrelation. So you can see that we just like we can diagnose the poo instead of clinical samples, but we can reflect to the clinical data and we can use this kind of thing to prevent the infectious disease. So it means that the environmental technology is also can be a health technology as well.
Okay, thank you so much for the answer. For Hasbi, you get your answer. Okay, thank you so much. Probably we're moving on to the next questions. For the participant, you want to ask another questions? Okay, Amadi, please.
Okay, so first of all, I'd like to say thank you for the opportunity. I'm Tanara. I'm a student of public health, of clinical science. So my question goes to Professor Achi. One of the problems that I personally feel as in Indonesia, I feel like health capability can help workers or health professionals in primary healthcare to use or to adopt the technology itself, especially in the rural. I want to ask the opinion towards the readiness and the acceptance of health workers if the health and efficient technologies that I mentioned before will be implemented in Indonesia. Like how's the strategy to solve them? Thank you.
Okay, thank you, Professor.
Okay, thank you for the questions. I think the important things, the first one is literacy. Literacy about technology and many things about technology is like Internet of Things, big data analysis. In the many platform, I think in Indonesia or in around the world, it's many platform you can use it. But the problem is literacy. Which platform context in your problem and your healthcare problems. For the health workers, I think you must choose with the appropriate technology. Uh, for examples, in primary healthcare, and in Indonesia is using referral systems like hospital is general hospitals, community hospital, national hospitals. Um, yeah, in many referral systems in hospitals, they have used many technology, but the technology is specially for clinical technology, um, for medicines and for treatment, for diagnosing, but it's meaningful platform for healthcare, for community. I think it is the challenges for us to creating the new technology, maybe with collaboration with startup. Yeah. In a hospital information system, I define the hospital information systems consists of clinical information systems and financial systems. And for the medical records, I think it is only for medical. But for public health, we have a challenging for um, using Internet of Things, big data analysis. I think in community many data, but not integrated. Yeah, integrated. Maybe some stakeholder have a data like community health centers in Indonesia called the Puskesmas, and many clinic have the data. But today in the BPJS is the body of the for using universal health coverage. They using PCARE. PCARE is primary care for electronic medical record, so integrated for the many clinic, many community health services, and I think it is the big data analysis. I using 1% of data BPJS, data universal health coverage, is the insight about the program TB because in Indonesia most of TB and diabetes mellitus and then the heart cardiovascular and heart and cardiovascular. I using data from 1%. Um, this indicate many problems in the community. And in Indonesia, maybe this is related with to person with question about health coverage. Because in Indonesia we have a problem about access, and today the access can be especially for financing. Yeah, but access in other access like in the rural area, I think in urban area is okay. But in rural area, this problem. That's why using artificial intelligence, using telemedicine, many tele, yeah, many telemedicine, consultations, and in Indonesia, you got Oncom. The platform calls Oncom. You know Oncom? Yeah. Oncom campaign gitu. Oncom is abbreviation for online consultation and communications. Singkatannya Oncom. Yeah. Okay. I think this is for, my answer.
Okay, thank you, Prof. Heri or Prof. Haji for the answer. For Zahra, do you get your answer? Okay, thank you so much. Moving on to the next question. For the participants that still would like to ask a question, please kindly raise your hand. Okay, besides Zahra.
Okay, good morning, everyone. I would say thank you for all the amazing speakers who have presented very informative material. And thank you for giving me the opportunity to ask this question. My name is Mutiara, and I'm a public health student at Brand PGs. I want to ask a question to Prof. Achim. As you presented before in your presentation that to enhance quality of health, medical devices have crucial roles in diagnosis patients, such as robotic system and or complex procedure. My question is how to develop a medical devices system that inclusive for all. Thank you.
Okay, thank you, Mutiara, for the questions. Prof. Haji, do you want to answer the question?
Yeah. In the medical devices, we have a roadmap. Yeah. In the roadmap, the first from ideations and then prototyping, testing. For my experience in US, I have went to US. University Shorten, California. Have many collaborations like GE, Philips, Medicine, Samsung Medicines, and the industry, the healthcare industry, is collaborations with academic and practitioner in hospital to developing, to modeling, prototyping, designing, testing the medical devices. But this one advance in technology, and the goals is for life expectancy and then the efficiency of health financing, efficiency cost. But that's why I have a long time to produce the healthcare industry. But if you can manage about healthcare interface, healthcare for therapy. For example, I'm a consultant in the Cancer Medical Center in Darmais. This is the National Cancer Center. And in Harapan Kita is the heart cardiovascular national cardiovascular centers in Indonesia. They're using the high-end technology. Yeah, they're using the high-end technology, using the minimum invasive. Maybe 10 years ago or 5 years ago, if you the subjects of the heart open thorax, now using only the catheterization for treatment the heart attacks. Yeah, this is the advance of technology. But as you know, this is for medicine. I think the challenge is for healthcare to develop, to modeling, testing, and so on about platform of public health. Yeah, and many lecturers today have a project, have research about public health devices. For example, like a software for healthcare children and moms, buku KIA, Kesehatan Ibu dan Anak, and many digitalizations of KIA, yeah, children and moms health for monitoring, for early detections and patients monitoring, and then for many things. Thank you.
Okay, thank you so much for the answer, Prof. Harry, for the Mutiara. Oh yeah, for Mutiara, you receive your answer. Okay, thank you so much. Please kindly give applause. Okay, we still have time for more questions. For participants that would like to ask a question, please kindly raise your hands. Oh, okay. Please, Kavati. Yeah, probably you can move a bit so the speakers can see. Okay.
Okay, good morning everyone. Firstly, I'd like to say thank you to all the speakers for the presentation. And thank you for your. My name is Nistina. I'm a public health student of UNCG. And I'd like to ask a question to Mr. Wiswanti. So from what you presented before, we have JKIs in 2014, right? But in 2015, we still have 50.23% of out-of-pocket money from the population. So why does it happen, and what does the obstacle that JKI face? Thank you.
Okay, thank you so much for your questions. For Paris Mami. Rina.
Inaya. Inaya, thank you for your question and for your time for your kind word for us. Regarding the question about what's going to happen before the implementation of the JKMT of the policy universal health coverage in global perspective, yeah, that's because our policy and our program are disintegrated and fragmented system. We have health insurance, and then the population with health insurance they want to choose because sometimes also the data paid twice. That is paid by the actors, by the jumpers, by jumpers that they claim twice or three times. So that makes the data, yeah, how to say that? Yeah, difficult to access the data. So that the out-of-pocket payment still very high in Indonesia. That's also one thing that makes out-of-pocket payment in Indonesia occur too many.
Okay, thank you so much for Mr. Rizwandi. Okay, for the participants, Rina, do you have your answer?
Yes, thank you very much.
Okay, please cover the.
Okay, thank you very much. Assalamualaikum warahmatullahi wabarakatuh. So I have vice deans, of course, all presenters, very important and excellent presentations from the our side, the APG and from Walailak University Thailand. Indeed, first I would like to express gratitude and sincere appreciation to the delegations visit to this university or university. This is great momentum, I think, for UPNPG that you visit closer to closer cooperation between UPNPG and Walailak University, Thailand. Refer to our signing memorandum of understanding had on December, I think, 2021. This is very good relation to both sides. So this is implementation. I think this is good implementation for both university because I think in 2022, if I have not mistaken, or 21 and 22, your students come to economic business faculty, 12 students. After that, also come from our university to your university. This is mobility students and also lecture mobility. And also December, I think our vice rector and delegation visit the university, beautiful university, and we know that the Walailak University is one of the best university in Thailand. So we are really happy that we can cooperation with one of the good university in Thailand. And just for your information that the UPNPG also, as the public university, have 7 faculties and more than 32 study programs, and 12,000, more than 12,000 students. So, of course, in Jakarta, the General University only two, University of Indonesia and UPNPG University. And others, there is University Public University like UNJ, this is especially for lecture, and the UIN, this is for British University. So only two actually in Jakarta itself. So we would like to refer to the MOU between both sides because of cooperation there is mobility students and lecture. So we hope that students from our university go to your university and from your university come to our university, not only visit 2 days, 3 days, or 2 weeks, maybe one semester, let's exchange students and also join publication and research. So this is very important and interesting topic that you already present. And also maybe the vice dean also can provide for double degree. I think this is good chance for both university, both school of public health and the faculty of science, this university. And also I think of a seminar discussions. So we hope that the complete program between both faculties or school and faculties will be good for the future. And also we receive from some students from some other university, like Jackson University and your university also. In our side from international cooperation, we hope that Port University will be much more the best example for our brothers ASEAN and Thailand and Indonesia. So once again, thank you very much. Over to the lecture, our lecture in Faculty of Health Science, maybe not only master degree but PhD program because I hear that a lot of the program from your university. So once again, thank you very much and good luck for your coming to Jakarta. Thank you very much.
Okay, thank you very
Yeah, yeah. Thank you very much, Professor Bambam. Sorry, yeah. Okay. Yeah, I also hope so that our relationship will be more like, like friendly in the future, and not only the short program but also the long term run, as you just mentioned. But I want to point out about the scholarship or the master PhD program that you just mentioned. As Pak Nupradon
show you guys that in our school we have both masters and PhD. So each program we have like two programs. First, the Master of Science in Health, Environment, and Safety. So this program, they are kind of multidisciplinary between they are integrated between health, safety, and environment. And we also have both master and PhD. And also we have international program. And another degree is public health research, which is also provided both master and also PhD. And for the international students, we also have the scholarship for the international students, for the kind of like outstanding applicants to apply. And actually, for the international student, they can apply all year round. I think yeah, because we are open like all year round. So if you are interested in pursuing your master and PhD in our school, like whatever health safety, health environment safety, or public health research. So just this easy way, just contact me or contact no, pardon. So the easy way, and then we can like proceed you to the coordinator of each program. Yeah, and we are very welcome all of you to study in our university.
Okay, thank you very much for the answer. Thank you also for
So actually, it's not only the program in public health. We also have other program, especially for the health side, biomedical side program as well for PhD. If you would like to apply for others, because in Walailak University, if you apply each program, you can request like for supervisor. You can request a lecturer from school of public health as a supervisor, but you are studying in the biomedical side, then you can. But just relate to your field and your future. It's okay. We also have the grant. I mean, yes, we also have the grant, particularly for the research grant for the student who gonna be actually. We also have the yes, mostly scholarship from the Thai government for the foreigner to apply to our degrees. But you can provide some information. Yes.
Okay, thank you very much.
Dual program right now in Walailak we have no dual program right now. Sorry? Sorry.
Not yet, but I'm quite sure now there are some schools that are trying to, to try to make it happen about the sandwich program.
Double degree, double degree. For example, 1 year or 2 years in our university, in your university, so there are two. So
In
inside
this program, maybe in Indonesia, 2 years, 1 year in Indonesia and 1 year in Thailand.
So I'm not sure about other program, but for our school, we have no the all degree yet. But maybe in future, maybe we have some
So we get double
yeah,
degree.
if we can do
Yeah.
it's
Oh
very,
yeah,
very
oh
good.
yeah, yeah.
Very good. Between us, but from the Indonesians and Thailand.
Good.
Yeah.
Australia is
Yes.
Okay, thank you so much for the answer. Yes, hello. Okay, so probably for terms of condition for the scholarship to apply on master or you can get free access.
just contact him.
Okay. Just contact for any of you that would like to ask about the scholarship for your master degree or probably for the lecturers that would like to take a PhD to Walailak and contact directly to Dr. Ferdi. Okay, so moving on.
Sorry, and yeah, overall, so for said faculty, economic, I think, and law faculty. But I don't know in faculty of health science, maybe. So, but
Okay, answer. Moving on to the next question for the participant. Do you have any other questions for the participants? We still have around 15 minutes. Okay, committee, please kindly. Oh, okay.
speakers, and good morning, everyone. First of all, thank you for the presentation. I'm Amanda. I'm a student of Public Health MBA. I would like to ask, so we all agree that people have access to the full range of quality health service daily, but in reality, there are still a lot of people who can access good health quality just because the social stigma such as gender or race or etc. And what should we do about it? That's all.
Okay, thank you, Amanda. To whom you addressing the questions?
Anyway.
Anyone? Okay, so thank you so much for the questions. For the speakers who would like to answer the question, from Eric, probably.
Yeah. Okay. Uh, as we know, health program is not just for treatment. Yeah. The healthcare continuum is from preventing, promoting, corrective, and rehabilitative. In the health preventions, it's many people, many health workers have contributed the community to engage to improving health care, and in level of in sub district in Indonesia called 3T ya, terluar, tertinggal, terluar, tertinggal, terbelakang ya, daerah 3T ya, saya lupa. Okay, in Indonesia, 3T, T is in outside the city, in rural area, maybe in the islands, so have the problem about access. Yeah. But in preventing healthcare, promoting healthcare, we have health workers like midwife, nurse to go in the islands and stay in the islands. In Indonesia, called program Bidan di Desa. So in the village we have a midwife, we have nurse, yeah? And in the suburban so we have pustu ya. Pustu is puskesmas pembantu gitu. Bukan untuk pembantu ya maksudnya ya. Puskesmas is community health centers, but in sub districts or in the rural area. So if we talking about the health program, yeah, not curative only, but it's beginning from preventions, promotions, and then treatment and rehabilitations. In rehabilitations, maybe for rehabilitative, they cannot go to hospitals, they cannot go to the healthcare facility, but many like home visit, yeah. Home visit for health workers and home delivery, and the call using mobile applications and go for treatment like past stroke and past maybe after a fracture, yeah. So they can rehabilitation in home care, home visit. Yeah. So we perspective paradigm is approach not only treatment but can access for in many things. Yeah. Thank you.
Okay, thank you so much for Amanda. Do you have additional
Can I
answer?
add more? Thank you, Amanda. I just want to add more from the Professor Harry. Okay. He also mentioned, he already mentioned about the health care system. It's not only treatment, right? But also prevention and promotion. So that's why I would say that's why the world needs you. That's why the world needs us as a public health officer. Because public health officer is health of the public, not health for the individual one. So I would ask you back, but don't forget me, don't answer me today, but answer me in the future, like how do you promote the healthy people, the healthy community, because it's not in our hands in the future, but it is yours. So yeah. So now our health is in your hands in the future. So yeah, let's answer it in the future.
I agree with you.
Yes, correct.
Thank you so much. Not only maintaining, also improving the healthcare in Indonesia, probably further for next year. Okay, thank you so much, Amanda. You receive your answer.
Thank you so much for the answer.
Okay, thank you so much. Moving on to the next question, probably from Walailak University. Some questions. We still have like around 10 minutes.
You are our priority.
Our priority. Is there any question for the speakers? Or probably about Jakarta or any other participants that would like to ask questions?
Still jet lag, still jet lag.
Or they are trying to ask a question while we're waiting for any participants. Do you have any other questions? Probably more questions? Okay, Kamani. For Walailak University, please kindly after this if you want to ask a question, one last question before we end the discussion sessions. Special for you.
Thank you. Good morning to all speakers today. Introduce myself. My name is Nafisha. I'm a student of public health in UPL Kesehatan Jakarta. I want to ask to the lecturer from Walailak University. Uh, Based on the latest data about COVID-19 from World Health Organization, as May 29, 2023, the fatality rate in Indonesia is about 2.13. In Thailand is only 0.72%. This number is below the average of Asian number is about 1%. Uh, in your opinion, why this could happen, and how Thailand handled the pandemic so that the fatality rate is below the ASEAN.
If you heard some news from maybe WHO or maybe the international news, in Thailand we have the strong um, we call it health promotion. We call like village volunteer, health volunteer. We have like village health volunteer in Thailand. This one is very important in Thailand. Can eliminate and control the COVID-19 during pandemic, particularly for the public health officer. They working together. That's why public health is very important in Thailand during the pandemic. Actually, we know that the medical doctors just treatment in the hospital, but for the control and prevention, the public health officer is the directly work on this. So as I told you, the villager volunteer, health volunteer, this is the key man in Thailand that they can knock the door in like public sick to give the knowledge to the people, like US, the knowledge, awareness, and also practice as well. That's why the pandemic in Thai, the number of the patient in Thai got low, and particularly for the death cases got low as compared to others. Yes, it is. I think that maybe that is enough.
Okay, and thanks to Thailand, I think we like to create some catchy words for the population of people to remember. And if you have seen, like in Thailand, we have measures called DMHTT. So this is the short term for the practice that we have to apply for protecting our health to prevent COVID-19. And actually, the people who don't know English, they can remember that word. So I want to explain what is the MHTT. So D from social distancing. It means that you have to stay away from each other like 1.5 meters. The M measuring it. Like if you go to the public places, they have to got like a temperature testing. Yes, the MHTT and H is hand cleaning or hand hygiene. So you have to like clean your hand frequently, for example. And the last T is, I think it's one of the good things that helps the health system in Thailand.
Okay, thank you for the answers. So the participation from the people, from the health worker, really try to eliminate the COVID-19 in Thailand, and also in Indonesia we have the application named Peduli Lindungi. For participants probably know to scan ourselves, our health temperature, and then our vaccines and other through the application to help maintaining COVID-19 norm in that area. Okay, thank you so much. For Nafisha, do you have your answer?
Thank you for the answers.
Okay, thank you. Okay, from Walailak University. Okay, please give applause. Is that our last question for this discussion session?
Okay, so next question to Dr. Patrick. Regarding water-based epidemiology, can recall from the only field setting, the extrapolate to an entire country. Would you recommend to collect more sample from fewer location or field sample from the location? Thank you.
Okay, so for Dr. Patrick, you want to?
And thank you for the EP students. The location or like how many to collect the sample is very difficult to answer, but because it depends on the budget, this is the most difficult thing. But actually, it's not only a domestic wastewater treatment plants in communities that can adopt this application. In the dormitories, in the university, or in the hotels, they have their own wastewater treatment plants, so they can collect the wastewater from their campus. For example, like UPNVJ, they have their own wastewater treatment plants. They have the students like live in the dorm, they can collect the samples and they can analyze. And once they got the positive results, they can inform and they get the student to test the clinical data and can just like issue the other measures to control like directly. So I would answer that it depends on the readiness of the organization or community as well, not only in community. Thank you.
Okay, thank you so much for Dr. Patrick for the answer. Do you get your answer?
Yes, it's so very clear. Thank you.
Okay, thank you. Please kindly give applause. Yeah, okay, I think that is our last question. Or the participant still have another questions? No? Oh, okay, one more. Okay. Oh, okay, okay. Or participant first, or okay, okay. Do you have the questions? Maybe can you help? Please be prepared because after this, our presenter would like to ask a question to the audience. Okay.
Good morning for all speakers and good morning everyone. I want to say thank you for your great presentation. Let me introduce myself. My name is Agatista. I'm a public health student from UNJ. I want to ask two questions to Walailak University speakers. First, in your presentation, you said that Bangkok is not included to be the part of COVID-19 sampling. Why does Bangkok airport not include to be the part of COVID-19 sampling, even though Bangkok is a tourist city? The second question is wearing mask still mandatory in Thailand? Because in India, many people don't use mask in public area. Thank you.
Okay, thank you so much. I'm sorry, what's your name again? Your name?
I guess.
Agis. Okay, thank you, Agis, for your question. Probably for
Agis? Is your name Agis?
I guess.
Agis.
I guess.
Agis.
Okay, so thank you for your question. So, first question about like sampling point in Bangkok, why we did not include the airport, right? So actually, as the Patrick mentioned, the important thing of the wastewater-based technology is the budget. So in Bangkok, normally, they have two main airport in Bangkok, one in Dortmund and one in Suvarnabhumi, in outside. The important thing that we signed, the first we signed to collect the sample from airport in Phuket, as Patrick mentioned, in Phuket is the first airport that open for the foreigner to visit Thailand, and then they transfer to other provinces by many transportation way like the plane, like the bus. And in Bangkok at that time, we collect the wastewater sample from community waste, particularly for the like from household use, for hospital use, that make accuracy. I mean like the specific point. It may be important for more than the hospital in Bangkok, because in Bangkok so many Bali, many people that why yeah, it may be covered as well for Bangkok. That's why we don't include the airport. We just use the household wastewater sample, and maybe I think
Yeah, but after we implemented the first one, actually we already did collected the sample from the airport in Bangkok as well. But it appeared in another papers. So if you want to see more, you just ask me directly and I can give you the paper about the results of the sample between Bangkok wastewater.
okay. The second question is again this
Yeah, face mask. I think
next.
Is wearing a mask still a mandatory in Thailand?
Actually, currently in Thailand, after the pandemic, maybe in the early of the year, we like free for face mask, maybe in public place and also in the household as well. They like no need to wear the mask, but some guys still be concerned on the health problem, maybe the COVID-19, they also still be use the face mask. But currently, the COVID-19 may the case COVID-19 cases may also increase in Thailand, in some area in Thailand. That I think in the future, near not far from now, the all the measure for the COVID-19 prevention will come again, and test net will be necessary to that again. And how about in Indonesia right now?
Same like
yeah,
Thailand.
I think it's the same. Some of people, it depends on the people if they are still or aware about the COVID-19 wearing a mask. If they are wearing a mask, I think some of us are not wearing a mask.
Yes, but in the last semester, particularly for the university, when you attend in the class, so many students will be wearing masks, because not only COVID-19 but other respiratory disease as well that they're concerned. Yes, in Thailand. Like a new normal practice that we don't care about the face mask. Even you got the flu, you don't meet anyone, you just don't wear the mask and come to attend the class. But right now, after COVID-19, it is the new normal practice. I think we have more concern on our health problem. Is it?
Okay, thank you. Do you have your
Okay,
answer?
thank you.
Okay, thank you so much for the answer for our speakers. Moving on, probably Mr.
Yes.
Mokado would like to ask a question.
Basically, if you maybe other questions, you have any questions, we have a question for the student,
Oh,
Indonesia
okay.
student.
So, is there any other questions?
A
No?
small gift, but
If there is no questions, probably Professor Mokado would like to give a question, and the one that answer the question will receive a gift.
yes, sorry.
Okay, so who wants gift? Ada yang mau hadiah nggak nih? Okay, so participants,
It just had three questions.
only three
Without a
questions.
limit, here, just a three. Who raise your hand first? Okay, everyone, could you help me to that
Okay.
student?
Is it only for UPN student or YF also?
Only for Indonesian student.
Okay, so
Walailak student, you already have this one.
okay, so
This is
this is
sorry.
This is only for the students from Indonesia. So please kindly, the one that get raised hand first will be picked to answer the question. So for Mr. Romano.
Maybe it's an easy question.
Easy question.
Very easy question. First question is if you can remember my slide. I just want to ask you about so in Walailak University, how many school of colleague we have in Walailak University?
Okay, how many school of the Walailak University have? I think okay, cannot see the profile. Okay, for public, please kindly give the microphone. Habis ngecek PPT tadi ya? Oke, oke. Oke. Yeah, the microphone. Yes, please kindly introduce yourself.
Okay, I will answer the question from Mr. Patrick. As long as I remember, the answer is 20 collisions in I'm not wrong. This is the as long as I remember. It's
Okay. 20, is it correct, Mr. Romano?
20? Is it 20?
I remember.
Is it correct?
Please kindly receive from Mr. Romano. Oh, okay.
Maybe a small gift from our school.
Congratulations for the first questions. Okay, we have two more proposals.
Next question.
Okay, next question.
My question is, if you remember the concept of the wastewater-based epidemiology, and if someone, like an uncle on the street, asks you the question, what wastewater-based epidemiology is, how do you describe him in very general? Just the easy term to answer this question to an old uncle just like me. So we're gonna answer this question. Oh, okay. Yep.
Okay, please. Please kindly stand up. Yes.
I want to answer the question, but as I remember, water-based epidemiology is about the use of water that someone use and can infected someone with the pathogen in the water. Is that right?
Okay.
And can I think you have some word to talk more. Can what? Can blah 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 to the community level. Can blah 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 to the community level. In fact, not infect. Infect. Impact. I'll start with the R. What flake? R. R. Yeah, that one. Reflect. Oh, reflect. Okay, thank you very much.
Congratulations to Raihan. Okay, we have one more question, so get ready.
And the last one is, does anyone can share the face mask management in Indonesia?
Okay, face mask management in Indonesia. Can anyone tell? Raise your hands. Okay.
My name is Muhammad Fatah Mubin. You can call me Mubin. Please remember my name. Because it will hurt if you don't remember. Okay. So the pest management in Indonesia is quite simple. That there is some communities named Satpol PP or Satgas Covid that always patroli bahasa Inggris. Okay. Monitoring someone that don't use masker. So if someone do not use masker, they come like. Anjingnya anjir. The management management in Indonesia is quite simple. But now we are free from that kind of mask, but we are still using that because I'm ugly, right? I'm using masker yang gitu.
Okay, thank you. Okay, I think from what we say is there is a COVID-19 officer that would like to warn us that they monitoring us about.
Wait.
Okay, documentations.
Yang penting saya Indonesia ini nggak masalah.
Okay, thank you so much, Ruben, for the answer. Probably for or Dr. Rizwan also want to ask a question. Oh, we have no idea. I am volunteer. Okay, I think. So there's no questions? No? Okay. So yeah, thank you so much for today's presentations. I also agree technology needs credibility and also easy accessibility. Of course, same as healthcare systems need credibility and easy accessibility. We can starting with developing an innovation, new point of view such as the wastewater utilization and of course the waste mass disposal. And said that also it is our generation responsibility also to maintaining and improving our healthcare system. Okay, I think that is a very productive session with participation. Thank you very much for the precious knowledge for all of our speakers. My apologies if there was a mistake pronouncing titles and names. And thank you so much for attending this student exchange session. For the speaker, you might kindly take your seat. Okay, thank you so much. Now I would like to give it back to our amazing master of ceremony, to Mrs. Karana Adiswa.
Ladies and gentlemen, we have come to the end of this enlightening, informative, and also fun lecture. I hope you all have enjoyed and got so much knowledge from the presentation and discussion of our distinguished speakers. Before we end the general lecture, we would like to give a memorable gift or some memorable gifts from our Faculty of Health Science, PJ to Walailak University. That will be represented by the Dean of Faculty of Health Science, Mrs. Desmond. Okay, we would like to please invite the head of health department, Mrs. Afi, to please come forward to give the memorable gifts to our guests from Walailak University. We would kindly invite our guests from Walailak University to receive the gifts. We would also like to invite Mrs. Desmawati to please come forward to give the memorable gifts to our guests from Walailak University. Okay, so Walailak University also has gift for us, um, and it will be given to us right now. We also have certificates for our internal distinguished speakers, Prof. Achim and Mr. Iswandi, and it will be given by Mrs. Desmawati. Okay, we also have gifts souvenirs for students of Walailak University, and it will be given by Mr. Aga Gutana. Thank you everyone. Happy anniversary and our faculty anniversary, and it will be guided by Miss Krishnawati. She will tell us what to say or what pose do we have to give.
Okay, so everyone please stand up. So for Thai student, okay, I will count 1, 2, 3, okay? 1, 2, 3. ขอแสดงความยินดี16 ปี Okay, okay. So after you pay VJ, said yay. Okay. Okay. UPN Veteran Jakarta, Indonesia.
Ditulis kali, ditulis kali.
Okay.
Sorry.
Okay. Yes. Okay. UPN Veteran Jakarta, Indonesia.
Yes.
Alright. 1, 2, 3. ขอแสดงความยินดี46 ปีผู้เป็นเวทรันจาการ์ตาอินโดนีเซีย Okay, but Thai students again. 16 ปี Faculty of Science, Faculty of Health Science. ขอแสดงความยินดี16 ปี Faculty of Health Science, UPN Veteran Jakarta, Indonesia. Yay! Right? 16 นะครับ16 Alright, 1, 2, 3. ขอแสดงความยินดี Faculty of Health Sciences, UPN Veteran Jakarta, Indonesia.
Okay, everyone, please sit down. Thank you so much, everyone, for the enthusiasm. We have come to the end of this event. I would like to thank Director, Dean, Deputy Deans, our guests from Walailak University, distinguished scholars, and all participants for participating in today's event. I hope this event has sparked your curiosity and inspired you to learn more about the topic we have covered today. I wish you all the best on your future endeavors and hope to see you again in our next event. Thank you and have a great day.